Healthcare agencies use several methods to prevent the spread of infection: standard precautions and transmission-based precautions. Standard precautions. Standard precautions are used by healthcare workers during client care when contact or potential contact with blood or body fluids may occur. Standard precautions should also be used when assisting a client with activities of daily living, ADLs, and using water, soap, or lotion. Standard precautions are based on the principle that all blood, body fluids, except sweat, non-intact skin, and mucous membranes may contain transmissible infectious agents. These precautions reduce the risk of exposure for the healthcare worker and protect patients from potential transmission of infectious organisms. According to the Centers for Disease Control and Prevention, CDC, standard precautions include the following: using proper hand hygiene at the appropriate times, using personal protective equipment, gloves, gowns, masks, eyewear, whenever exposure to infectious agents may occur, implementing respiratory hygiene for staff, patients, and visitors, proper cleaning and sanitizing of the environment, equipment, and devices, handling laundry safely, using transmission-based precautions when indicated. Hand hygiene is the process of removing, killing, or destroying microorganisms or visible contaminants from the hands. The easiest and most effective way to break the chain of infection is by using proper hand hygiene at appropriate times during patient care. Knowing when to wash your hands, how to properly wash your hands, and when to use soap and water or hand sanitizer are vital for reducing the spread of infection and keeping yourself healthy. There are 2 hand hygiene techniques: hand washing with soap and water, and the use of alcohol-based hand rub, a BHR, also referred to as hand hygiene gel, or hand sanitizer. Healthcare providers' hands are the most common mode of transmission of microorganisms. As a nursing assistant, your hands will touch many people and objects when providing care. When you touch a client, their personal items, medical equipment, or their surrounding environment, you can indirectly transmit microorganisms to the client, another client, yourself, equipment, or a new environment. Microorganisms can easily be transferred from your hands to others or objects in the healthcare setting if proper hand hygiene practices are not followed. Consistent and effective hand hygiene is vital for breaking the chain of transmission. It is essential for all healthcare workers to use proper hand hygiene during specific moments of patient care, immediately before touching a patient, before performing an aseptic task, such as emptying urine from a Foley catheter bag, before moving from a soiled body site to a clean body site, after touching a patient or their immediate environment, after contact with blood, body fluids, or contaminated surfaces, with or without gloves, immediately after glove removal. Hand hygiene also includes healthcare workers keeping their nails short with tips less than 0.5 inches and no nail polish. Nails should be natural, and artificial nails or tips should not be worn. Artificial nails and chipped nail polish have been associated with a higher level of pathogens carried on the hands of healthcare workers, despite using proper hand hygiene. Proper hand hygiene includes hand washing with soap and water, or the use of alcohol-based hand rub. Both procedures will be described in detail. Hand washing involves the use of soap and water to physically remove microorganisms from one's hands. Certain healthcare situations require hand washing with soap and water instead of using alcohol-based hand rub. A BHR, for example. Hands must be washed with soap and water if they are visibly soiled, have been exposed to blood or body fluids, or have been exposed to norovirus C. difficile, or Bacillus anthracis. The mechanical action of lathering and scrubbing with soap for a minimum of 20 seconds is vital for removing these types of microorganisms. Soap is required during hand washing to dissolve fatty materials and facilitate their subsequent flushing and rinsing with water. Soap must be rubbed on all surfaces of both hands, followed by thorough rinsing and drying. Water alone is not suitable for cleaning soiled hands. The entire procedure should last 40 to 60 seconds, and soap approved by the health agency should be used. Specific details about hand washing with soap and water will be shared later in this module. When washing with soap and water, the Centers for Disease Control and Prevention, CDC, recommends the following steps. Wet hands with warm or cold running water and apply facility-approved soap. Lather hands by rubbing them together with the soap. Use the same technique as the hand rub process to clean the palms and fingers, between the fingers, the backs of the hands and fingers, the fingertips, and the thumbs. Scrub thoroughly for at least 20 seconds. Rinse hands well under clean running water. Dry the hands using a clean towel or disposable toweling from fingers to wrists. Use a clean paper towel to shut off the faucet. Safety considerations. Always wash hands with soap and water if hands are visibly soiled. When working with clients where C. difficile, norovirus, or Bacillus anthracis is suspected or confirmed, soap and water must be used. It is more effective in physically removing the C. difficile spores compared to a BHR, which is not as effective at penetrating the spores. Friction and rubbing are required to remove transient bacteria, oil, and debris from hands. Always use soap and water if hands are exposed to blood, body fluids, or other body substances. Multi-step rubbing techniques using soap and water are required to promote coverage of all surfaces on hands. Common errors when washing hands with soap and water. Not using enough soap to cover all surfaces of the hands and wrists. Not using friction when washing hands. Not washing hands long enough. The mechanical action of lathering and scrubbing should be a minimum of 20 seconds, and the entire procedure should last 40 to 60 seconds. Missing areas such as the fingernails, wrists, backs of hands, and thumbs. Not removing all soap from hands and wrists. Shaking water off hands. Not thoroughly drying the hands. Drying hands from wrists to fingers or in both directions.